Here today with Dr. Kashani. How are you today?
I'm great. Hi, how are you?
I'm doing great. I'm really looking forward to talking more about, women's health and how COVID-19 has possibly impacted care.
Absolutely.
Can you start by sharing the signs and symptoms of infertility?
Sure. So, by definition alone, if a couple has been trying to conceive for 12 months or more, then that defines infertility. And if you're over the age of 35, then even 6 months of trying to conceive is considered to be a diagnosis of infertility. Now, beyond that, there are other things that could clue you into infertility or what you said, the signs and symptoms. So for a man, if there are situations where there's erectile dysfunction or ejaculatory dysfunction, meaning a man can't ejaculate, can't have an erection, then that could be a sign of infertility. Also, things that may have happened prior to a man, for example, they were born with hernias or an undescended testicle or had major testicular trauma. These are all things in earlier life that can lead to infertility in the future. So it's things to be aware of. For women, it's even more complex. So the biggest thing that you can think about is if you have irregular periods, then you may have a risk for infertility. Irregular periods means you might not be ovulating. And without ovulation, unfortunately, it's very hard to get pregnant. So that's one thing to look out for. I say your menstrual cycle or your period is really a vital sign to tell you, are your hormones functioning normally? And if they are, if you get very regular periods every month, almost the same day, then that's a good sign. And if something deviates from that, that could lead to a sign for infertility. And then another big thing is for infertility is looking at, if you've had prior pelvic surgeries. In a woman, things like having a ruptured appendix in the past or having a condition called pelvic inflammatory disease or gonorrhea chlamydia, this can lead to lifelong issues with the fallopian tubes, which is absolutely necessary for conception. So that's another thing to clue yourself into in terms of a possible sign for infertility. And then the big thing is something called endometriosis, which is a very complex condition that's chronic, lasts a long time, and it affects women who have really severe, painful menstrual cycles, pain with intercourse, and sometimes pain when they have a bowel movement. And if you have endometriosis, about 50% of those women will have infertility. So that's a big thing that shouldn't be overlooked.
You had mentioned irregular menstrual periods. What would you define that as, and how would someone possibly, need to consider seeing an OBGYN or seeking provider help?
Great question. So first and foremost, you want to assess your periods when you're not on any kind of contraception or hormones like birth control pills. And the best way to kind of gauge your periods is to start tracking your periods. You can do that using a calendar method. You can use tons of apps that are out there. And you want to note the very first day of your period from one cycle to the next and track that for a couple of cycles. Regular menstrual periods come every 25 to about 35 days. That's a normal cycle length. And if you're noticing that you go from having one period and it takes another 50 days to get your next period, well, that's prolonged, and there's reasons that that can happen. It can be conditions that are related to a thyroid abnormality, other hormonal disruptions, and a very common condition called PCOS or polycystic ovary syndrome, which again is something that you would have to talk to your doctor about to get the proper testing and workup for.